So welcome everyone. Welcome to the Navigating the Pediatric Lupus Journey webinar series part 3, Preparing for Life as a Young Adult. This is the third in a 4-part series, and we will focus on transitioning from pediatric to adult care. Parts 1 and 2 can be found on our local website at the Philadelphia Tri-State Chapter, as well as likely your local chapter. If you can't find parts 1 and 2, on your local chapter website, please just send us an email at info@Lupus Tri-State. And Maggie, I believe, is also going to put the link in our chat tonight, so you can access those or contact your local chapter. So the fourth and final session in this series is on April 15th and will be called Living Your Best Life. And we'll be really looking at a holistic approach to living with pediatric lupus. So watch for email updates from your local chapter for these and additional new programs that are coming out throughout the year. So just a few housekeeping notes before we get started. We're really thrilled to have you join us this evening. Before we jump out with our presentation with Dr. Chang, we will be following that conversation with a panel discussion. And if you have questions during the program, use the chat or the Q&A feature. We'll be monitoring those. And please know that we're not able to address any specific or individual treatment or diagnosis questions. We will do our best to generalize it if you do get a little bit more specific. But if you do have individual treatment and very specific questions, we recommend that you go to your doctor. Feel free to reach out to your local chapter afterwards, or again, info@lupustristate.org is our email, and feel free to send us an email. This webinar is being recorded and will be available on your local chapter's website shortly after this program, as well as it will be on the Tri-State chapter too. So let's get started. Without further ado, I am really honored to have Dr. Joyce Chang with us tonight and to introduce her to you. Dr. Chang is an attending rheumatologist at the Division of Rheumatology at the Lupus Integrated Nephritis Clinic at the Children's Hospital of Philadelphia, which we call CHUP, as well as as an assistant professor of pediatrics at the University of Pennsylvania Perelman School of Medicine. Her clinical interest is in helping young youth with lupus and other connective tissue diseases take charge of their disease and successfully navigate the healthcare system into adulthood. She directs the research efforts within the CHOP Lupus program and has funding from the National Institutes of Health and the Lupus Research Alliance to develop strategies to prevent long-term problems from childhood onset lupus, such as heart disease. One of Dr. Chang's main focus is improving the healthcare transition from pediatric to adult care for youth in rheumatic diseases. She is the transition champion for quality improvement efforts within CHOP and has worked on developing tools to measure how well the care team is doing with processes to help youth prepare for adulthood. She also co-leads the Transition Learning Collaborative, which is a multi-site effort supported by the Childhood Arthritis and Rheumatology Research Alliance, which we call CARA. And the TLC, the Transition Learning Collaborative, aims to understand how to implement healthcare transition processes within pediatric rheumatology across the centers across the US. So thank you for being with us, Dr. Chang. I'm going to turn it right over to you. We are really honored. Dr. Chang is really an expert in this, so thanks.
Thank you, Cindy, for that introduction. I'm just going to share my slides. So I'm very happy to be here. Thank you so much for inviting me. This is a topic that is near and dear to my heart. And I will just say, before we get started, that all opinions expressed here today are my own, and they're not necessarily representative of the organizations that I work for. And so let's begin preparing for life as a young adult with pediatric lupus. So as we dive in, I would first like to just acknowledge the elephant in the room, which is that transition is an emotionally charged topic for essentially everyone involved: parents, teens, young adults, doctors, nurses. And part of the reason why this is so emotionally charged is that we know that the stakes are really high, especially for our teens and young adults living with lupus. A lot of them go off into adult healthcare systems and may not necessarily do very well. We know that, up to 9% of patients in some areas of the country develop end-stage renal disease after leaving pediatric care. And so that can cause a lot of anxiety for parents. We also know that it's a potentially life-threatening disease that can have really severe complications. And so we worry about that. As providers, we know our young adult patients don't always like to take their meds, and they're also more likely to report experiencing lupus symptoms when they leave pediatric care. And then for our teens and young adults, oftentimes they have a deep attachment to their pediatric providers, and it can be very hard to think about letting go and actually transferring over to an adult provider. So if there are two things that humans and people have a really difficult time with, it's letting go and it's dealing with uncertainty, because that makes us extremely vulnerable. And so the goal of this webinar here today is really to turn some of these very negative emotions, such as fear and anxiety, into a positive anticipation and appreciation of developmental milestones. And so what does healthcare transition actually mean? When we say transition, we mean a gradual, organized process of moving from a very child, family-centered model of healthcare to an adult, more patient-centered model of healthcare. And so there are 3 phases in transition. The first phase is the planning or preparation phase. And this actually spans many years, often starting as early as age 12 or 14. And it builds up until the time of transfer to an adult rheumatologist. And this is the period when we expect teens to acquire the skills that they need for healthcare independence. Transfer is the actual handoff from the pediatric to the adult provider. And after that, the final stage of transition is integration into an adult care model. And what I wanted to emphasize is that the actual transfer to an adult doctor is just one tiny piece of transition. And so most of this talk today is going to focus on the preparation aspect of it. And so these are the stages that I've illustrated here: planning, transfer, and integration. So starting with the preparation phase, what are some of the skills that actually need to be acquired? You don't just throw a 16-year-old into the driver's seat of a car for the first time and expect them to miraculously know how to drive. But well before they turn 16, first they have to learn what all the road signs mean. So knowing their lupus signs and symptoms. What are all of those things on a dashboard? You know, they need to know the names and doses of their medications and what each of them do. They also have to develop skills that allow them to communicate with the care team. And so this is what I refer to as steering their healthcare, because rather than communicating through a parent, teens have to learn how to bring up their immediate concerns and questions. They also have to learn how to make appointments, so navigating the actual healthcare system. And they have to know what to do when there's an emergency, who to call, when and when. And then finally, they have to have basic knowledge of how our healthcare system works. So understanding insurance is probably the parallel parking of healthcare independence. Some of us as adults don't even really fully understand how insurance works. But the key is this isn't an exhaustive list of skills. It's just to give you an idea of what are some of the things that have to happen. And one of the important issues is that these need to be practiced. If you think about how many hours of practice you need to log behind a wheel before you can even apply for a driver's license, the same applies to healthcare independence. And when we talk about practice, who is responsible for driving that? So the teens are responsible, parents are also responsible, and healthcare providers take part in that responsibility. And during this shift in responsibilities, it's really important to keep in mind that our brains continue to mature and develop well into young adulthood. So sometimes even age 25 or 26. And there's nothing magic about turning 18 that suddenly makes somebody fully mature. It comes with legal rights, but young adults make decisions in a very different way than parents or providers, even after they turn 18. And one of the things that we think about is the gradual shift that an adolescent or teenager has to make from concrete thinking, which is considering only what's in front of us at the moment, to abstract thought, which is appreciating concepts that you can't see or feel in the moment. But that actually takes time. And so sometimes we get frustrated when teens don't necessarily make the same choices that parents would. But understanding some of this developmental process allows you to acknowledge that it is part of the normal growth of a teenager. And so they may not be able to understand the consequences of certain actions, like the fact that not taking their medications might cause them to miss their prom in 6 months because of a lupus flare. It can sometimes also make it difficult for concrete thinking teens to link cause and effect in regard to certain health behaviors. Like, for example, how vaping might actually impact their ability to perform in basketball. And even when they do know cause and effect, they might not actually be prepared to avoid those risks. For example, deciding not to get into the car with an intoxicated driver, even if they know that that's a dangerous thing to do. And so realizing this is part of the normal developmental process can ease some of the tensions. The third thing that happens in the developmental process is that teenagers attain the ability to actually think about how others view them. And this can lead to a desire to hide their chronic illness or hide the fact that they have lupus because they're still trying to figure out who they are. And so this is how teens actually build an identity. It's really thinking about how others perceive them, but also deciding who they want to be. And when other people, for example, if a parent, peers, or siblings view a teen as a sick or disabled person, that can sometimes become how the teen actually views him or herself, and it takes over their identity. So sometimes it may seem that everything revolves around the lupus, but that's not necessarily who a person is. And so, we don't go around introducing ourselves as somebody who's with lupus. There are so many other important pieces of identity. And lupus may certainly shape the experiences of our teens, and it may be an important part of their life, but it doesn't define who they are. And so during this period of building a self identity, teens may experiment with different peer groups to try to see where they fit in. And sometimes having lupus helps them build a positive identity. So, one example of this is teens with lupus wanting to, or desiring a healthcare career. But on the converse side, it can also contribute to negative self esteem if they have an identity crisis, if they can't identify anything outside of their lupus that helps them figure out who they are. And so, one of the questions that I always ask all of my lupus patients is, what do you want to be when you grow up? Because if they can't answer that, they can't even imagine themselves in the future, then that is sometimes a red flag that they may have negative self-esteem. And it's important to figure that out because those types of negative self-esteem can actually affect their ability to engage in their health. And so, how do we give teens the space to both develop their identity and learn how to be independent without just having them fall off the edge of the world? So, one of the important concepts is giving teens and young adults the space to actually make their own choices. And one example I like to give is of a teenager who was taking a medicine called methotrexate. Some of you may or may not be familiar with it, but in combination with alcohol, it can actually cause liver failure. And so we ask all of our teens to avoid alcohol when taking methotrexate. And he wanted to drink with his lacrosse buddies. And so his mother actually did a very good job of giving him the space to bring that up during the visit. Because even though it was very obvious to her that the answer should be, well, you shouldn't drink anyways, and you need your methotrexate to control your arthritis, so there's no question about it. She actually gave him the space to bring up his concerns at the visit and talk to his doctor about it. And so when you actually give them that ability to make the choice and to ask the hard questions about what are the risks of stopping the medicine versus drinking alcohol while you're on the medicine, a lot of times teens will still arrive at a good and reasonable choice. And so you just have to give them that space. One of the other important things to provide is unconditional love, but with very clear boundaries, because there may be times when you actually need to step in. And one example is if a teen drinks and drives, sometimes you have to revoke their driving privileges. And that's just one of those things that's a hard stop. And so defining that between a teen and a parent is really important. And the last thing to keep in mind is that what works for a parent may not actually work for a teen. So one example of this is a lot of parents keep a binder or a lupus binder to help them organize their child's healthcare. And so it can be really tempting to impose that type of organizational process on a teenager, but sometimes it doesn't work because that's not how they organize their life. So they may prefer to keep things on their phone or on Post-it notes. And so working with them to figure out what they need and what works for them is super important. And that also supports their development of their own identity. So I do want to move on to a few nuts and bolts of what to expect during this transition preparation phase. One of the things that we start talking about around age 16 is something called confidentiality. And this is an understanding that information, personal information that discussed between a doctor and a teen will not be shared with anyone else without their express consent. And some of the things that we talk about and refer to as being part of confidential conversations are the tough conversations about alcohol and drugs, about reproductive health and sexual behaviors. Mental health is a super important one. So mood, and then peer or romantic relationships, because those can affect how a teen interacts with their health and makes decisions about what medicines they take or decide not to take. And so it's really important that teens feel comfortable talking about these things that really have a huge impact on their health in a confidential manner with their physicians or care providers. And so generally around age 16, we recommend that teens start having some private time during the visits where the parent's not in the room. And these are some of the reasons why, we have to give them that time to do it and to practice. Then privacy, patient privacy is something a little bit different. So at age 18, when we talk about healthcare privacy rules, these are rules that protect personal and health information. And so when somebody turns 18, when you turn 18, your health information belongs to you and it doesn't belong to a parent. And so the 18-year-old gets to control who receives that information. And so oftentimes, parents are still involved in care coordination well after age 18. And so it's very important that we talk about having the 18-year-old consent to sharing health information with their parents or other caregivers. So how do you know if you're ready? Well, there are actually quizzes you can take that help you assess whether you're on the right track, acquiring all the skills that you need to be successful in adult care. This is an example from gottransition.org, which was a huge nationally funded effort to try to develop resources to support youth with chronic illnesses and transitioning to adult care. So you can actually log on to the website and you can take the quiz, and it's an interactive quiz, and it asks questions like, do you know the phone number of your doctor's office or how to reach them? And you would go through a series of brief questions, and then they would give you a score and certain concrete things to work on. Parents can also take a quiz for themselves to how do you know your teen is ready? And it's a similar interactive format. So this is all part of the transition preparation. And once you've done all that and you've finally gotten to the point where you're thinking about transferring to an adult doctor, you need to make sure that you've talked to your care team about who and when you'll transfer to. and you really don't want to wait until the last minute. So we recommend that you begin the search at least a year in advance. And the actual age at which this transfer happens will differ depending on what institution you're at, whether your teen is going to college or starting work. And so it is a conversation that needs to happen with the care team. And part of the reason why you don't want to wait until the last minute is because we know a lot of young adults experience prolonged gaps in care. So on average, it's probably about 7 to 8 months between the last pediatric visit and the first adult visit, but a significant proportion of patients, especially lupus patients, experience very, very long gaps up to several years, during which they're not getting any medications refilled, they're not being monitored for disease flare, and up to half of them end up having unscheduled emergency room visits or hospitalizations. And so the planning piece is super important. And then in terms of how to actually find an adult doctor, there are some practical aspects to this. So most patients and providers express that they want a referral from their pediatric rheumatologist because they feel more comfortable with somebody their pediatric rheumatologist knows. And that's all good and great. And oftentimes we can give a good recommendation, but there are other factors involved, like, are they covered by your insurance? Are they accepting new patients? Sometimes the one that we want you to see is not. Some other wish list considerations are, do they work in a lupus clinic? Is lupus their specialty? Is there a network of other specialists available? So if you have lupus and it's a very medically complex case and you need to see a nephrologist and the heart doctors and the lung doctors, you may want to consider finding a rheumatologist that's in a network with other specialists so that they can coordinate your care, like in an academic center, for example. And another wish list item would be whether or not that rheumatologist is trained in both adult internal medicine and pediatrics. Now, that's fairly rare, but there are more and more these days. And so that may be something you would consider when choosing between two different people. And then the last point here is to make sure that you actually inform your pediatric team who you'll be seeing and when the appointment is, so that they can actually give any information that's required and do the communication that's essential to ensuring a smooth handoff. But after you see your adult doctor, it's not over yet, because this is really important, and it's just as important as the actual transfer, because just getting to see an adult rheumatologist once doesn't actually finish transition. There's a lot of adjustment that has to happen after you enter adult care. And one of the important things is to understand what the adult practice's expectations are of you, of the young adult, and of the parental caregivers that may be helping coordinate care. Because when failure happens, it's usually a discordance or a disagreement between expectations that a patient has of the practice or vice versa. And so some of the things may work differently in adult care. The visits are shorter, they're more problem focused. So if you don't come with your concerns ready, the adult rheumatologist may not go through an exhaustive list of questions to try to pull that out of you. And so those are some of the things that may be different. And there may not be a long grace period if you're late and you may be forced to reschedule. So how many times did, a parent have to call our office frantically saying they were stuck in traffic and they were going to be half an hour late? And we say, okay, we'll add you in. That may not happen in adult care. So you need to know what to expect. And the other thing that becomes important is that life continues outside of your healthcare and outside of lupus, and things get busier. You may have more school, there may be work obligations. And so communicating what you need from the care team ahead of time is really important, particularly when it comes to things like work notes or accommodations for college. And using technology can help you take control by increasing some of the communication that you have and facilitating that with your care team. So many adult practices have patient portals where you can log in to get your own health information and to make appointments. So use that to your advantage. So those are some of the practical tips. And we're very excited to hear from some of the young adults who have gone through this whole process. And these are the acknowledgements. So I do very much want to thank Cindy for organizing this and the whole Tri-State chapter and all of the LFA members who are participating in this.
That was fantastic, Joyce. Thank you so much. Such a great starting point for us to really have kind of a baseline of information about that, about the transition process for sure. So let us get the rest of our panelists in as they are starting to come in. All right. I think we've got everybody. Yep, we do. All right, so let's just start right in. We're going to do a couple of interjections, and then we're going to jump right into our discussion. So again, thank you, Dr. Chang. Certainly a great place to start and leads us into a lot of good conversation. So let's do some introductions for our panel. You've already met Dr. Chang, who's going to stay with us, so thank you again. Dr. Christina Rouse is a pediatric psychologist in the Division of Urology and Pediatric Health and Behavior Program at CHOP. Dr. Rouse completed her fellowship in general pediatric psychology at Nationwide Children's Hospital and her internship in child and adolescent psychology at the University of Rochester Medical Center. She's a psychologist at CHOP's Lupus Integrated Nephritis Clinic, or LINC as we call it. You may remember Dr. Rouse from part 1 of this webinar series, and we're thrilled that she's with us again. Thank you, Dr. Rouse. Welcome. We have Marty Thomas, is a mom of 3 grownish children. I have some of those myself. A retired high school English teacher and lives with her husband in St. Louis, Missouri. The youngest daughter, Sarah Rachel, was diagnosed with lupus at the age of 13. She graduated early from high school, then went on to the University of Missouri. This began her transition from pediatric to adult medical treatment and support. Sarah Rachel is now 23, and the transition has evolved, but is still ongoing, as Dr. Chang just mentioned. Marty now serves on the Lupus Foundation Board of Directors, and that would be the Heartland chapter, consults with PhD candidates in education, and tends to her 3 Yorkshire Terriers. Alexis Hubbard is 22 years old and was diagnosed at the age of 17 with SLE, and a few years prior to that had been diagnosed with alopecia areata. Am I saying that right? I'm not sure that I am. She currently works full-time and goes to school full-time. She's a busy girl, studying clinical social work, and she has fully transitioned to an adult rheumatologist just this year. And last but not least, we have Aliyah El-Kuni. Aliyah is 27 years old and was diagnosed with SLE and lupus nephritis at 17 years old. She is currently a full-time college student and also has a full-time job as a leading clinical research coordinator for Dr. Alfred Kim at the WashU Lupus Clinic and Division and Rheumatology. She transitioned to adult care to an adult rheumatologist at the age of 21. So first, thank you all for being with us tonight. It really is tremendous to have so many different voices to share through this, because it is quite the process. As we just learned from Dr. Chang, it is not an overnight process, right? It's an ongoing process for many, and it takes a little bit of time. So just a reminder for our guests tonight that if you do have additional questions, please use the chat or the Q&A. We'll do our best to get as many answered as possible. If you do have questions following this program, send us an email at info@lupustristate.org. And so let's just jump right in. We've got some great questions for our panel. So let's start out with Aliyah and Alexis, and jump in with whoever wants to go first here. What concerns and fears did you have about transitioning to adult services, versus, as Dr. Chang mentioned, the nice, friendly, warm and fuzzy pediatric aspect? And what helped you kind of manage those concerns and fears?
So a couple of my fears were just managing everything myself. Eventually, once that happened with medication, making sure I was keeping up with seeing my doctor every 3 to 4 months. And also if something else came up in my medical care, making sure I was connecting to the correct doctors that I needed to add to, like my rheumatologist, nephrologist, and any other new doctors I needed.
I would agree with Alia. I think also my biggest concern was having a voice in my treatments, and being heard by my doctors, because oftentimes, sometimes you could be drowned out, or they can overstep and things of that nature. So I was very concerned with that. I think one thing that helped me during that process was just even practicing being confident, asking questions, even on the simplest of things that I wanted to learn more about on my patient care, and just being in control and not allowing things to happen that I wasn't comfortable with.
And that's not easy to do, for sure. Marty, as a parent, what were your concerns as you're watching Sarah Rachel go through the process, right? And having to be that parent of, as a parent, it's hard to step back and watch that happen and maybe fail a little bit. So how did you manage that from your end as a parent?
Well, certainly there were many concerns, like the things that the two ladies just spoke about, especially about going to the doctor and taking her medicine. So some of the things that have helped us is, one, I still continued to go to the doctor with my daughter for a time, with her permission, of course, but she felt more comfortable with me there because guess who was the one who knew her whole medical treatment and she didn't? You know, I had all the history of everything. So being willing and being there for your kid who's not a kid anymore, but to go and take notes. Next thing is, getting her to be able to sign the HIPAA form that would allow her doctors to speak to me and to give me information was really important. As Dr. Chang was talking about, starting to research an adult doctor early so that we had kind of a transition plan in place so that we knew the doctors would communicate with each other, and there wouldn't be a big gap, like she said, in her treatment. And one of the things that really gave us some peace of mind was knowing our own children's hospital's limits on how long Sarah Rachel could actually go there. It was surprising to find out that they'd keep treating Sarah until she was like 26, if necessary. So there wasn't that big, huge fear of, oh my gosh, I'm 18 now, I have to go to the big person's hospital and that's scary and I'm losing all my doctors. And, if she felt like she needed to go back to the children's hospital, that was available for her. So that was great.
Yeah, really good point. Dr. Rouse, as the mental health professional amongst us and the psychologist, how do you offer advice to families as they're starting this? It can create a lot of stress between, moms and dads and their child about going through this transition. So how do you prep them for that?
I really focus on the communication aspect. So always talking about how the individual is feeling who is transitioning, and then also the fears of the parent. I know sometimes we want to hide how we feel in front of the kids, but it's much more helpful to be transparent about it. Like, yeah, I'm nervous too. I mean, it really stinks that we have to move on to a different doctor, but I think we can do this. One thing though that I think is really important is to not treat it like you would your own transition, because as a parent, unless you have the diagnosis, you don't know the experience. When you say, oh, well, when I turned 18, this is what life was like for me, it's not going to be the same. So it's not compare your own experiences with it, but look to ask the child and the individual who has the diagnosis, what are some of your fears? What are some things that I can help with? Because it's not going to be the same as when I transitioned. Those are some of the things that I've been working on with some of my families.
Yeah, really good point. And Dr. Chang, not everybody might be with a pediatric rheumatologist that takes the time to really help them transition, right? That really focuses on that. You would hope that everybody does, but it's possible that they don't. How would you encourage them to speak with their physicians, and what should they really ask for if they're not getting that lead in, right? That guidance to help through that process?
Yeah, so this is where I think parents and families can really advocate for themselves, because I think that most doctors and pediatric rheumatologists believe that transition is really important, but they may not think they have the time to address that in all of the visits. But we also know that the most productive conversations about transition happen when a family brings it up, because then we know you're engaged and interested in it. And then we can give a lot more specific guidance about, what resources to look for and what skills to practice. And so that is available to you. But I would definitely encourage families to actually ask their doctors about it, and to make that an important part of the visit and an essential part of the visit. And at the same time, in the healthcare system, we're doing a lot of things trying to improve on our end, making sure that we also bring consistency in terms of discussing transition with families.
Yeah, thank you. Alia and Alexis. All right, so as you transition through this and you're taking on all this responsibility for your own care, what actual challenges, and we're going to come back to your advocating your voice. I want to talk more on that, Alexis, but were there tools and strategies that helped you get over some of these scheduling appointments, taking all of this on? How did you guys manage it? Dr. Chang referred to, your parent having the binder, and that may not work for you. So, whether your moms and dads had binders or you kept the binder, or you went to your phone, or how did you work through some of that stuff?
So I actually have like a little journal that I take with me to like every appointment. And in the journal, I have all of my concerns, questions that I may have, because I noticed throughout the years when I transitioned, if my mom or dad wasn't with me at the appointment, I would forget things. My mind would kind of go blank. And then after I left, I was like, oh, I should have asked these questions. I guess I'll just wait till next time. So I really recommend taking a journal, a diary, whatever you like, or even just putting like notes on your phone in an app, asking, and then just taking notes, asking, if you have to ask the doctor again to clarify something, that's your time to do that. So I think that's helped me a lot.
For me, I would also agree with Ali. I didn't do a notebook. I did use my phone because I take my phone everywhere. So anytime that I had a new symptom or I had a flare up or something was wrong, I wrote it down. I wrote down how long it lasted, how it made me feel, what was the symptoms, any questions that I had, because again, you go in there and you literally completely forget all the questions you had going in, because it is a quick appointment. They want to know the issue so they can help you. And so So knowing your questions up front and being able to ask those and having them ready is definitely a good tool, even if it's just like the notes section in your phone.
Well, and often, and this goes for adult care, adults, not just transitioning, but when you experience something, whether it's a change in your symptoms or relief of your symptoms, by the time that may happen weeks before you get into a doctor's office and get into your visit. So it may not even be something you're experiencing at that point in time. So it really goes out of your mind. So writing down and keeping track of things is really important. Marty, as a parent, how did Sarah Rachel's transition, and as you're still processing through it, right? How has she, and really from your perspective of the way you used to do things, right? The way that you kept her books and kept her medical records and kept everything versus what she's trying to do. How's that worked on your end?
Well, at first it didn't work very well. And communication was really the big key. When she went away to college, she was communicating with us about, what she was experiencing, but she wasn't able to communicate well enough when she was really getting ill when she was away. And, it ended up in a medical emergency situation. When she went to college, FaceTime wasn't quite a thing yet. That would have been very, very helpful to have that kind of availability or being able to see her, but also things that would help FaceTime, like the Kinsa thermometer, that is an app-based thermometer where you can get reports in multiple locations on your phone. Also helping your child transition and set up like auto refills of medications, so you know that it's being actually mailed directly to them. So there's not well, I didn't have a car, so I didn't pick it up, and then I forgot it, that kind of thing. And my daughter said she used a when she really got into, okay, I really have to take this at this time. She used a medication reminder that was an app on her phone. So those were all really good tools that she used to help get through that kind of communication time.
I think it's important to remember that as parents, with no matter what we're doing and trying to assist our kids, they don't usually want our help, right? They can do everything on their own.
Oh yeah.
But when you do something and you just say, you know what, how about we set up this reminder, right, for your, right. And they're like, that's great, thanks, right? So sometimes it's all in the presentation and how things
yeah,
are.
so you can say, would there be an app that could remind you to take your medicine at a certain time? Oh, well.
It's so true. So Alexis, I want to go back to what you commented on about having a voice and being your own advocate. No matter what age you are, whether you're a 50-year-old adult or a 21-year-old adult, it can be really challenging for some people, right? And we can experience you could be very intimidated by somebody very easily, especially, in the medical field where you don't feel like you have enough knowledge, or you're new to a physician, you don't want to, so as a young adult, how did you find your voice? And was there a specific situation that you found yourself in or that forced you to find your voice and be that advocate that kind of really made it very relevant for you?
I think most of the time I had to practice. I'm very confident in things that I'm knowledgeable about, and obviously in the doctors, they know a little bit more about things that I don't know anything about. So practicing about being confident and speaking up in times where, even though I'm shy about it, I have to find my voice. I think one defining moment was speaking with my dermatologist. Obviously it's they have interns, and I went through the stages of alopecia where I had to get shots in my head and things of that nature. And after that experience, I definitely realized I didn't want to do that anymore. I didn't want to go through those emotions. That I ended up having another episode, and the intern suggested doing the shots, and I made it very vocal that I did not want to do that again. And he kept agonizing about it. He kept bringing it up, and I'm like, please stop. I've made my decision. This is not something I want to do. And once my doctor had came in, he told her about it, about doing more shots. And she's like, well, it's her decision ultimately. And she asked me what did I want to do. And I vocally told them, and I had to feel confident enough to know that at the end of the day, it's my decision about how I want my care to go, and that I have other options. And so I think that was the defining moment where I'm like, okay, I can do this. I can be confident and express what I need from my doctors and what I prefer not to do.
Well done and well said, that's for sure. Aaliyah, anything on your end about finding your voice, having to advocate? Have there been a situation?
Yeah, I mean, I still have times where I have to kind of be more stern. And, you go into a doctor's appointment and something that may be a major concern for you may not be such a big concern to the physician, because they're looking at other things when they come in to see you, different symptoms you may be experiencing. And I think just making sure that you find a good doctor that's a good fit for you, because I've been to multiple rheumatologists, adult rheumatologists, and I did not, even when I've tried to make it clear, and I was, asking, I'm like, do you have the time to listen to what I have to say? Because there's some clinics where things are moving so fast and they're in and out. You want to make sure you find a good doctor that wants to sit down and listen and make sure that your concerns are being heard, and, just making sure everything's clear on your end and theirs.
And that's a good reminder that if you're really not happy with your physician, it's really okay to look for a new one, right? There are options out there, and it does have to be a right fit, that's for sure. Because you're there for you're in it for the long haul. You need to have a nice partnership with your physician. Dr. Chang, Dr. Rouse, any words of wisdom from the physician end on guiding a lupus warrior into finding their voice, or not, having the confidence to speak out and share their concerns with a physician?
So I really just want to echo exactly what Aaliyah and Alexis said, that you should be advocating for yourself, that you should, if you don't feel comfortable, you should say no. You shouldn't be in a position where you feel forced to do something if you don't feel good about it. I tell every single person I work with that there's no such thing as a dumb question. No matter how small, no matter how you think it might not be that big of a deal, or you think the doctor's going to laugh in your face. If the doctor laughs in your face, you find a new doctor. You don't let somebody make you feel like you're nothing, and that any worries that you have are belittled. So I think trust is really important. Even when someone works with me, I say, you may meet me and not like me. And if you don't trust me, if you don't feel like you can talk to me, this isn't going to work. So I feel like it's like that when you meet with a doctor. If you have that feeling of just that person wasn't listening to me, I don't think that they understand what I want, they kept pushing this one thing when I told them I didn't want to do it, it's really important to be able to kind of look at those warning signs and say, this isn't the right fit for me.
And I would just add that even though sometimes I feel teens or young adults can be intimidated by a healthcare provider because of some perception that they have so much more knowledge about your body, that's not actually true. You are the only person that knows your body better than everybody else. So just keeping that in mind and not being intimidated by the medical aspect of it. And sometimes as a much younger person than I was right now, one of the things that I found really helpful was sometimes before a doctor's visit, I would rehearse in my brain over and over again, what am I going to say? Because this is my major concern. How am I going to say it? How am I going to bring it up? And some of that hesitancy, you might sit there for a while and oh, I really want to say this. I really want to say this, but I can't seem to get it out in that moment because they're asking you all these other things. Having rehearsed it in your head a bunch of times can sometimes help you bring up a concern that you might not have felt immediately comfortable bringing up in the beginning.
Yeah, and that reiterates what Alexis does in practicing, right? And that's really does help us in so many ways. I also, I think it's a good reminder that knowledge is power, right? So when we understand what we're talking about, we have a lot more confidence to talk about it. So learning as much as you can at programs like this and different things that the various Lupus Foundation chapters offer are great ways to just learn and educate yourself more about lupus, for sure. So utilize those resources. So, Marty, as we're talking about advocating for ourselves, and we also know that even as adults, we need others to advocate for ourselves. So can you speak to the importance of a health proxy or health power of attorney? It sounds like you have had an experience with that.
Yeah, there's a couple different things you can do as parents or as a family to kind of work through the transition. And some of it is a little bit legal. And usually hospitals and doctors are really willing and kind and want to work with you through this process. But it would be really great when your kid is maybe 17, that the whole family really discuss what healthcare is going to look like in the following years. That doesn't mean forever, but in the next few years during the transition. And there are two documents that could really help a family prepare well for the transition, whether you're over 17 or just approaching that age. The first is what people know of a lot more, which is called power of attorney. But power of attorney, it basically gives you financial power over the finances of, say, an 18 or 19-year-old and dealing with their health care and their health insurance, and being able to talk to the healthcare providers and the health insurance themselves. But the one that's a little less known is the healthcare proxy. And this one is actually more helpful to families. This one says that even if my child is not comatose or completely incapacitated, I, as their parent, we've discussed and come to an agreement, I can participate in their health care. I can make decisions for my child. Now, we don't supersede the child's rights, but it does mean we can be in the room and we can talk about the test results and we can make decisions. And often my daughter would be like, just do whatever my mom says, just I don't know how to decide between this medication and this medication. My mom or my dad has researched it. So what did they decide? So it does, again, it's important to remember that the young adult still has the control, the ultimate control. But this allows parents legally to be in the room, to be part of the process. And we found obviously those are really helpful, especially when you're not at a children's hospital anymore, you're at an adult hospital.
Yeah, very, very good, helpful information. There's a great question in the chat I want to address. And that is for Alexis, Elia, and Marty, as you experience the transition from pediatric to adult providers, what differences did you see? What did you feel? What were the big takeaways of, oh, we're not in Disney World anymore, right? We're not in pediatrics anymore. How did you guys see that?
Or for us, it was definitely, it felt less, unfortunately, it felt less caring. It felt less individual. So you really kind of felt like, yeah, you got to figure some of this stuff out on your own, as opposed to kind of the doctors just coming in and presenting you with all of the information. So I would say that I'm not saying that the nurses and the doctors weren't caring, but it certainly felt like a different level of personally caring for your child, as opposed to, oh, we have this patient that we're nursing back to health.
I totally agree with that. I really do. Yeah. And I think another big thing was when you're in children's hospital, they want to figure out what's going on, even if it's not something that they may handle. They may need to pull another doctor in, but they work with you, connecting to that other doctor until, you figure out what's going on there, and everybody's really interconnected. I feel like being in the adult hospital, it's kind of, oh yeah, you need to go see somebody else. And it's like, okay, like, do you have somebody to suggest? And it's kind of like more you doing all the research on your own. And then they're like, oh, okay, well, like, let me know what they say or what happens. Then you come back, you have to report yourself or request that other doctor to do that. I just don't feel like it's very interconnected as it was at children's.
I definitely would agree with Marty and Alia. It's definitely it's doing most of the work, doing your own research, doing your own investigating. If you do need to see, like Alia said, if you do need to see another doctor, you doing that. It's definitely all the kiddie stuff you kind of see if you go to children's is completely looks like a regular doctor's office. As far as standard goes, I mean, when you go in there, of course, you will see your intern and then you'll see your doctor, but it's definitely a lot quicker, I feel like, than you would see at a children's office. They do explain certain things to you, but a lot of it's like, okay, let me do more research on my own. It's not sit down for 30 minutes to an hour talking about and making sure you understand what they're talking about.
Yeah, and it brings us back to the importance of having your voice to ask those questions, to say, hold on, I don't understand that, or, can you tell me more about that, and really force that conversation to happen. So another reason why it's so important to really have that voice and advocate for yourself. Great, that's a great question. Thank you. You guys are both working full time, Elia and Alexis, and going to school. You've got pretty busy schedules, I would imagine. And you may have had to handle this before, or you may be prepared to handle it. But if you have a flare, you can't go to work. How are you handling with sharing, your disease, having a chronic disease, and Have you told your employer? Ella, you're in a little different situation. You're in a lupus clinic, so I'm guessing that they likely know. But that being said, how do you prepare for that with your employer? It's facing different things. Your mom's just not writing you a doctor's note, right, to get out of school.
I think for me, I was very vocal with every employer that I had. I explained what it is. Some people like always, oh, I have a cousin, I know a friend or something like that. So explaining to them, definitely like the things can be good one day and bad another, but always letting your employer know that, hey, I'll definitely try to let you know in advance if things go hey, or if I can't come in, definitely try to give you that warning. But I feel like every employer that I've ever worked for has been very compassionate and very understanding of what's been going on. I've never ever had to call out of work, thank God, because of lupus. But if I will ever need to, also make sure on my part that I don't have any points against me, or if I have PTO time that I can use, and applying for things like short-term disability and long-term disability, to have that as a backup plan as well.
So now I'm in a really good spot, just because everybody that I work for knows that I have lupus, because they all are connected to our local lupus foundation chapter. And it is a very comfortable feeling, just because I can be like, I do not feel good, I need to go home. And it's no questions asked after that point. And I feel really comfortable. But before that, when I was younger, around like 22, I would say I worked for like a big corporate company, and I did not want anybody to know that I had any health issues. And it was extremely hard for me to take off work, because I would push myself way too much. I do regret doing that. And now that I've gotten older, I've kind of just come to terms that it's going to happen at times. And I need to figure out like how to manage when it happens right away, instead of letting it get so far in that I am extremely sick. I've had to quit jobs in the past because I got so sick. I think just managing it and figuring out how to reduce my stress level, taking care of myself and balancing everything I need to do.
Yeah, very valid point. Dr. Rouse, how do you advise your patients for that? Working isn't just an adult problem, right? Many teens have jobs and have to face this issue, along with adults in full-time jobs.
I actually talk about this with one of my patients who has lupus, and she's 18 now. We're talking about the working and going to school and doing all of that. And one of the things, exactly like was mentioned, we get overwhelmed and then we push ourselves too hard, and then we have to call out of work. And so there's no real equation for that balance. It's just found over time. So with her, a lot of the things that we were working on were working in self-care strategies and taking breaks. Like, even if she's feeling really, really good, it doesn't mean push yourself harder. It just means let's keep going, or let's kind of stop and not keep going, so that way we can take a break. And you know what? I feel like I could clean everything right now, but you know what? I just worked, I just did my homework, let me take a break and just sit down and do nothing for a little bit. So for her, it's been a lot of balance, because there have been times where she's gone too hard and she had to call out of work. And then there are some days where she said, I felt like I could do more. And I said, that's probably where we know the balance is. So a lot of it is that trial and error that we've been trying to figure out. It's not going to be perfect. But it is something that, like, I find that if you're feeling good, that's usually when you want to ask yourself, is this my good baseline?
Excellent advice.
Yeah.
Marty, talk to us from the family perspective. A lupus diagnosis can affect the entire family in different ways, right? Whether you're the parent, a sibling, or the brother, sister, whatever it is. As your daughter became an adult and really took on these adult responsibilities, how did that change? Your daughter was diagnosed at 13, right? So obviously now you're in a different level. Adults living with adults is always challenging. And so how did that affect your family? And if so, how did you kind of work around that?
Well, it's affected our family, as you said, they're and in different transitions. earlier on, I would say one of the things to really keep in mind isn't about the lupus patient. It's, are there other children in the family, and how are they feeling about this kind of specialized attention, the specialized medical attention that the lupus patient is receiving? And how are you processing that as a family? Is a really important kind of topic to not only discuss between, if there's a spouse, but also with the children as well. But as Rachel got older, Aaliyah was talking about having a job and having a hard time, either keeping that job when she was ill. It sort of affects the family because we see a lot of kind of jumping around from thing to thing until she could find her real spot. So, until she found a career and a place where she felt like she was accepted, they knew she had lupus, it was working for her. Like, Aaliyah was saying, when she feels bad, people don't second guess, she just is able to go home. So I think finding that right fit was really important. And, and her brother and sister found different paths, and that's fine. But just everybody understanding that her, the lupus patient's path is going to be different. And, we all have to understand each other.
Very valid point about the siblings and how they're acting and being treated and how they're feeling, more importantly, how they're feeling. So thank you for that. I want to go back to something that Dr. Rouse brought up, which is balance, right? First of all, it's so hard for all of us to find balance no matter what. But Aaliyah, when you're working a full-time job and you want to have a social life and you want to exercise and you want to eat healthy and all that stuff, and by the way, you've got to manage your lupus and all of that. What have you found has worked for you? We'll start out with you on that one. And have you found something that's worked?
Yeah, so I really watch my diet, and I try to do a food diary to see, if something's maybe not making me feel so well with, because I'm on high dose of Cellcept, so my stomach is super sensitive. I would say I kind of plan out my week. So I see what I have due for school that week, what meetings I have coming up that week that are already planned, because things, will pop up. But I kind of plan out everything, and I'm like, okay, I can work out around this time. And even if it's a 25-minute class online, which I've switched over to, it's just an app. If it's 25 minutes, it's 25 minutes. And I just try to squeeze it in the morning, and I stick to waking up at the same time and going to bed at the same time every night. And my getting a good night's sleep, making sure you're sleeping well, has been a game changer for me, and managing my pain and all of that. So.
Excellent. Alexis, how's that been for you? Have you found balance? tell us, please tell us, have you found it?
I'm doing better. It's definitely still a work in progress. I am 22 and I'm still working it out. This semester, I'm doing better. I have a big calendar. I plan everything.
Good.
From family to relationships to school to work. I have this right in front of me. I have this big calendar, so I can see as soon as I wake up, this is how my week is going to look. This is how much free time I have for myself. And just as much as being like, hey, my family wants to hang out. Let me see if I have time, because putting too much on your plate each day could definitely cause you to completely crash. And that's when you start to feel bad, and that's when your lupus starts to act up. So planning has been everything from down to the wire for me. And I've gotten a lot better this semester, especially on doing that.
And as Dr. Rouse mentioned, it's almost when you know that, oh, I could have done more, that's probably the right place to stop.
Yep.
And it's hard to know that, when you're, oh, I still feel so good, let's go do something else. And then you're like, oh, okay. It's a hard lesson to learn, but it's a tough one. And turning back to the science for a minute, Dr. Chang, and you mentioned this a little bit in your earlier presentation, But what do statistics show about the level of disease management post-transition to adult care? Can you just speak to that again? And, you know, how well are we transitioning from pediatric to adult care?
So I would say that there's not a lot of data. And part of the reason for that is when people leave the pediatric healthcare system, that also means their records leave with them. So it can be hard to track that type of information. But of the limited data that we do have, we know that the majority of young adults have an increase in their lupus symptoms when they leave pediatric care. Whether or not those would be considered flares by their doctors, we don't know. We also know that health-related quality of life, so how young adults perceive their overall well-being, is worse after leaving pediatric care and going into adult care, even compared to other people or other lupus patients who are the same age who stayed in pediatric care. And so those differences do exist. And we also know, that in some certain high risk patients, so people who have organ involvement and who also don't have a lot of financial support or who don't have good insurance, are at even higher risk of having poor disease outcomes. So, in certain groups of people around the country, like even up to 9% of the patients developed end-stage renal disease, meaning they have to get dialysis or go for a kidney transplant. And from our standpoint, that's a really bad outcome. We also know that there is a higher mortality rate in young adult age patients with lupus compared to their younger peers. And so all of those are the things that make us nervous, and things that we pay attention to, which is why I think it's so important that we're talking about it. And then we're talking about the different strategies to make sure that people are prepared, that the young adults and their parents and their doctors are all prepared to avoid those outcomes.
Yeah, scary and super important all at the same time, that's for sure. And Dr. Rouse, one final question here as we wrap up. We're a little overboard on time, but all of these adult responsibilities are so stressful. Being an adult is just not as fun as it is being a kid, and in so many ways, as we all well know. So how do you guide your patients, and what advice do you have for everybody joining in and listening to manage this stress? And it's a lot to take on.
My main thing is going to be self-compassionate towards yourself. You're only human, and you're also handling a whole bunch of things at once. It's really important to treat yourself like you would one of your friends. So like if you are dealing with flare-ups, you're going through big transitions, and just like Dr. Chang said, that the transitions cause flare-ups, like when you're going from pediatric to adult care, you're starting a new job, or you're having other big life transitions. You'll have probably lupus flare-ups, but also changes in your mental health. You'll have increase in anxiety or depression. You'll be more irritable. You'll be very overwhelmed. And so being nice to yourself during those times and almost saying to yourself, like, it's okay, I feel this way. It's okay that I'm not up to speed on everything that I'm supposed to be. I'm going through something really big right now. Anyone in my shoes would be would be having a hard time with this, because you're only doing the best you can. And when you start to push yourself and you say, oh, I should have finished all my homework, or, oh, I shouldn't have missed yesterday at work, or, oh, you know what, I should be doing X, Y, and Z. My room should be clean right now. My house should be clean right now. Like, you beat yourself up, and then you just end up down this spiral. And so part of something that I do talk about with the families that I work with, and especially the teenagers going, and even some of the young adults, is figure out where your control is. So for example, you can't control your flares. You can't control, your schoolwork. You can't control your work schedule. You can't control a lot of things in life, but you can control small things. And I heard some people say, like, you can control your sleep. You can control what you eat. You can control how much you go out and how often you see people. You can control who you let into your life. You can control what your day looks like. I know I'm probably hitting a sore subject right now with the pandemic, but this is the same conversation I'm having with a lot of people with, I have a daily routine in the morning, regardless of what my day looks like. And that keeps me grounded. it keeps me feeling like every day is okay, no matter what the day looks like. And I feel like it's the same for people with chronic conditions, is you don't know what the day is going to look like. But if you have some sort of consistency, some sort of grounding, you feel like you have control and you can actually handle more than you think you can. Whereas when we don't feel like we have control over anything, that's when we start to spiral. So, but regardless if you're even having the control, my main message is to be self-compassionate towards yourself, because it's really hard to handle all of these things. And the nicer you are to yourself, the more you're going to be able to move forward and get through these harder times quicker.
Excellent advice. Unfortunately, as I said, we are over our time limit, but it was such an amazing conversation. I'm sure we could continue on for another hour and continue talking about this topic. But I do want to give you all, is there any last, remarks, parting words, words of wisdom that you'd like to share with our viewers and attendees tonight? Dr. Chang, I'll start with you.
No, I just want to reiterate, love yourself, love the process. Like, this is a really unique opportunity, and there are good things about becoming an adult. So appreciate those milestones.
Marty?
Just as a family, to navigate it as a family, whoever your family is, and for patients, don't cut your parents out because you think you're 18 and you can do this by yourself, because you're going to try and it's not going to go well. And then you're going to need your parents again. So don't cut us out. We just love you.
Alexis?
I think my biggest is to advocate for yourself, to research, and to always take care of yourself first. You are the most important. You can't do anything if you're not feeling well. So definitely just take care of yourself.
Aaliyah?
Just want to say, like, don't be hard on yourself if you can't do something, and ask for help. Ask your parents for help if you need it, or whoever is your social support system, and just take one day at a time.
Well said. Dr. Ross? Any last, so you just left us with wonderful words, but I'll give you one more shot.
So I actually just want to say, when you do transition to adult care, it's not goodbye, it's see you later. I love hearing from families when they've gone and they've done wonderful things. I had one family actually email me. I haven't seen them in like 2 years, and she updated me on how her son was doing. And I can just say, it's so nice to hear from people. So don't be a stranger. We still want to hear from you. We miss you. So reach out.
Very nice. I love that. Well, thank you all. I really seriously cannot thank you all enough. This has been tremendous. Sharing your time, your wisdom, your experiences, to help others in the same situation or who are about to transition into adult care. A lupus diagnosis is certainly a journey, and for every part of the family. And we so appreciate you sharing your journey with us tonight. So if you have any additional questions, please follow up with your local LFA chapter, and feel free to email the Philadelphia Tri-State chapter at info@lupustristate.org. We will be sharing the recording out again to the other chapters, and again by email to those who registered through the Tri-State chapter. Thank you again. April 15th, join us for our 4th session about a holistic approach to living with lupus. Have a wonderful evening. Stay safe, everybody. And thank you again to everybody on our panel. Have a great night.